So what the aim of this webinar to do really is to try and encourage dentists to be at least aware of the advances that have been made in endomicrosurgery, to consider adding it onto your kind of treatment plan options, and to work with either yourself to make sure that you kind of can upscale and to consider adding it, or to work with your local endodontic surgeons to incorporate it into treatment planning. So the way we're going to try and work this webinar is we'll just do some case selections first, and then Paula will look more into the actual technical aspects of the microsurgery and how to do it step by step.
Thank you, Daniel, for the invitation. For me, it's a big honor to be here sharing with you cases and this patient about endodontic microsurgery. Thank you.
Yeah, my pleasure. So let's start. So basically, I'm a specialist as well, so I work exclusively in an endodontic practice, but I work very closely with prosthodontists, with periodontists, and with general dentists as well. And one of the biggest kind of issues that we have is kind of treatment planning, and it's to make sure that we're giving patients the correct options and allowing them to make a decision then based on what their requirements are. So now it's got more difficult than ever to kind of make decisions, and it's there's so many different options available. Now there's whole extremes of cases where there's dentists who just do implants, and it's like all they want to do is implants. There's other extremes of dentists who just do endo and all they want to do is endo. But it's really important to have good knowledge of all the kind of options that are available and to be able to advise patients accordingly. Unfortunately, there is a perception that endodontic treatment isn't successful. And this is a case where a young girl was in her 20s, she fell and she has an incisal enamel dentine fracture here in her upper right one. And the treatment went well. You could have a root canal treatment, but that's not likely to work. And then you need to take the tooth out and you need to do an implant. So maybe you're better to do an implant straight away. And as an endodontist, this kind of thinking is really kind of upsetting to us because we know how successful root canal